Unacademy. This is your educator for biochemistry, Dr. Shivangi Shukla. This channel is Unacademy Future Doctors, and do let me know if I'm visible and audible to all of you. Let me just check if the live stream has started or not. Okay, great. So what we are going to read right now is gluconeogenesis. Okay, this is the third session of glucose metabolism. Yesterday in the first session we finished with the structure of glucose, the different nomenclatures related to glucose, how we make different structures of glucose, straight chain, ring chain, Haworth projection, and the different types of carbohydrates, different nomenclatures associated with carbohydrates. Sorry. In the second session, we did glycolysis and Krebs cycle in detail, and tonight we are starting with gluconeogenesis. Okay, it is an extremely important concept, gluconeogenesis. I have already given you the introduction that gluconeogenesis is the opposite of glycolysis, isn't it? Gluconeogenesis is the opposite of glycolysis. There are a few steps in glycolysis which are reversible. Okay, but the steps that are irreversible are those that we have to focus on. Okay, now speaking of focus, this is the session called this session is a part of a series called Focus Prof 1 and Prof 2. Okay, we have completed with a super fast crash course covering the entire syllabus of biochemistry in a rapid manner and a rapid revision series. Both of them were directed especially for those who are going to take their professional examinations in a few days or a few weeks. Now we have started with the focus series, which is specifically directed towards comprehension and better understanding and comprehensive learning. Okay, this learning will be comprehensive. That means you will understand and then you'll learn. Okay, so let me just quickly take you through the types of subscriptions available on Unacademy for NEET PG. There are two types of subscriptions, Iconic as well as Plus. The Plus subscription comes with access to video lectures from top educators across the country. They're live as well as recorded sessions. You also get you can also access their notes as well as you can also get access to their notes in the PDF format, and also you can attempt the live quizzes that the teachers present in their the educators present in their session. Okay. The second type of subscription is the Iconic subscription, which gives you access to resources from Prep Ladder. Alright, that is why it is called Best from Two of the Best. Okay. If you have to take a subscription, this is the interface that you are presented with. You'll have to select whichever subscription you feel like taking, you wish to take. You have to select that, and then you have to put in the educator code here before payment for availing 10% discount. Okay, already the prices are extremely discounted, but if you wish to have an additional 10% discount on top of that, you have to put in the educator code DRSHUKLA. Dr. Shukla is the educator code, and before midnight, that is a few minutes before midnight, if you put in this educator code DRSHUKLA, then you are going to get 22% discount, not just 10, rather 22% discount. This we are gifting you on account of the new year. Okay, all right. So please, it is my earnest request to you guys, if at all you are planning on taking the subscription, do it right now before the 5th of January gets over. Before the 5th of January is over, you have to please take the subscription using my subscription code DRSHUKLA, because it will fetch you 22% discount. That is a lot. Okay, almost 7,000-8,000 for a 1-year subscription plus subscription. That is a lot of money. Okay, that will be reduced. Okay, so now we have let us just quickly go through all the topics that we have discussed. This is how we started with the properties of carbohydrates, different types of carbohydrates, what are the different nomenclatures associated, polysaccharides, monosaccharides, disaccharides, oligosaccharides, what are the three types of structures of glucose, what is starch, what is cellulose, what is glycogen, inulin, dextrins, chitin, what are epimers. Then yesterday we started with glycolysis. All of you, please remember the steps of glycolysis. We are going to come back to this again and again in tonight's session of gluconeogenesis. This was Krebs cycle. Alright. Now we are going to start with gluconeogenesis. So what is the meaning of gluconeogenesis? As is our pattern, we will break this long word down into small words. Gluconeogenesis means genesis of glucose from new compounds. What are these new compounds? What are these new compounds? They are non-carbohydrate compounds. So what is gluconeogenesis? The definition of gluconeogenesis that you will write in your short notes is synthesis of glucose or glycogen from non-carbohydrate precursors. Okay. So if you see, this is glucose or glycogen. So what will be the purpose of gluconeogenesis? To prevent hypoglycemia. Isn't it? Right at the start of this the metabolism of glucose, in the first session itself, I told you how plants synthesize glucose through photosynthesis. But animals can also synthesize glucose through a process known as gluconeogenesis, and this is that process. Okay, so what is the function of gluconeogenesis? It will prevent hypoglycemia. Suppose a person has not been taking glucose or any meal, and that person urgently all his blood glucose levels have been exhausted. Now what will happen? The person will need to form glucose inside. So he will produce, now all his glucose and glycogen stores have been exhausted. So where will he synthesize glucose from? From non-carbohydrate precursors. And this process is known as gluconeogenesis. So what is one simple utility of gluconeogenesis? To prevent hypoglycemia. Okay. Whenever a person is fasting, firstly, what is used? The blood glucose level. The blood glucose, it gets rapidly utilized. Then what is utilized? The glycogen stores. Those also get utilized fast. After that, what is utilized? The non-carbohydrate precursors. And they form glucose through gluconeogenesis. Got it? Understood? Now, what are the substrates for gluconeogenesis? They will be non-carbohydrates that are glucogenic amino acids. That means those amino acids that are capable of producing glucose. Lactate, glycerol. Glycerol is what? Glycerol is a fat, is an alcohol. Glycerol. It is a trihydric alcohol. Trihydric alcohol. Propionate. All these molecules can produce glucose. How? We'll read. What are the sites? We have seen how for any metabolic process, we should know what are the sites where it can occur, what are the sites where it cannot occur. Very important. So the sites where gluconeogenesis occurs, two main sites are the liver and the kidney. It also occurs in the small intestine. Okay, so do you see how beautifully liver is the storage form of liver has the storage form of glucose, that is glycogen, and once that is also utilized, then liver does not stop. What does liver do? Liver quickly turns towards gluconeogenesis to produce glucose. Okay. Now, what are the important steps what are the important reactions through which glucose is produced in gluconeogenesis? Pyruvate changing to phosphoenol pyruvate. You remember in glycolysis, this was the irreversible step where phosphoenol pyruvate changed to pyruvate. The last step. The enzyme was pyruvate kinase. Now I told you that time also all the irreversible steps of glycolysis you should know because they will occur in reverse in gluconeogenesis with the utilization of another enzyme. Okay, so the enzyme converting phosphoenol pyruvate to pyruvate was pyruvate kinase, and the enzyme converting pyruvate to phosphoenol pyruvate, we'll read later on, this occurs via two steps. We'll read it. Now fructose 1,6 biphosphate gets converted into normally in glycolysis, fructose 6-phosphate gets converted into fructose 1,6 biphosphate through phosphofructokinase. In gluconeogenesis, this irreversible step will occur in reverse through a different enzyme, fructose 1,6 biphosphatase. Okay. Similarly, glucose gets converted into glucose 6-phosphate through hexokinase or glucokinase. Glucokinase is in the liver. We had discussed this just yesterday, right? And this was the first step of glycolysis. Now this is occurring in reverse through the action of different enzyme, that is glucose 6-phosphatase. Okay, phosphatase A's will break this. Okay. Now, in the synthesis of glycogen, we have completed this in the super fast series. If you don't have the context, you can just attend the super fast series on glycogen, okay, or the rapid revision series, any of them, and then you'll understand, you'll have a fair idea of how glycogen is synthesized. So, glycogen gets synthesized from glucose 1-phosphate units. How are these units formed? Through the action of phosphoglucomutase enzyme. There's an enzyme called phosphoglucomutase. This enzyme converts glucose 6-phosphate to glucose 1-phosphate and vice versa. Phosphoglucomutase. Okay, so the glucose 6-phosphate molecules will get converted into glucose 1-phosphate, which through the action of glycogen synthase will get converted into glycogen. Okay, and then glycogen will break down to glucose 1-phosphate through glycogen phosphorylase enzyme, glucan transferase and debranching enzyme. Different enzymes, they will be involved in glycogen metabolism. Okay, understood all of you? Now one by one we'll take these reactions in detail. Now the first step is, the normal step in glycolysis is phosphoenol pyruvate converting to pyruvate. Okay, phosphoenol pyruvate changes to pyruvate through the action of enzyme pyruvate kinase. Okay, pyruvate kinase converts to, phosphoenol pyruvate converts to pyruvate through the action of enzyme pyruvate kinase with the production of ATP. Now what happens is, in gluconeogenesis, reverse happens, that is pyruvate will be converted to phosphoenol pyruvate. How does it happen? Pyruvate will first be converted to oxaloacetate. Where is oxaloacetate? Where have we heard of it? In the Krebs cycle. Remember, Cricket Council of India often appoints smart staff for main office. This office is oxaloacetate. Okay. Now this oxaloacetate is formed by carboxylation of pyruvate, and the cofactor is biotin. Biotin is a vitamin which is a cofactor here, and it utilizes ATP. So three things are important. Carboxylation occurs, as is evident from the name of the enzyme, carboxylase. Pyruvate is getting carboxylated. Addition of carbon dioxide is carboxylation. The cofactor is biotin. Always remember the vitamins that play a role as cofactors. Extremely important for any short note. If you're getting a short note on biotin, you don't know anything apart from it is good for hair and skin, you don't know anything apart from this, then you can include this reaction. Okay, the examiner is going to be super impressed with you. Okay, so biotin is a cofactor in pyruvate carboxylase and it utilizes ATP. Three very important things. Now this oxaloacetate will utilize GTP. It is not utilizing ATP. It is very unique. It is utilizing GTP. Extremely important. Do focus here, guys. It is utilizing GTP, decarboxylation. The carbon dioxide that had um, come in is now getting decarboxylated to form phosphoenol pyruvate. Pyruvate, you see, pyruvate is a oxaloacetate is a 3-carbon compound. Pyruvate is a 2-carbon compound. This phosphoenol pyruvate is also a 2-carbon compound. Got it? Understood why and how? Okay, no, sorry, 3-carbon. Okay, sorry. Whatever. Don't get confused with this. It's okay. It's okay. Don't forget about 3-carbon, 2-carbon, 4-carbon. It is going to confuse you. You just remember that this pyruvate is getting converted into oxaloacetate, and this oxaloacetate is getting converted into phosphoenol pyruvate. What is the enzyme? Since uh, phosphate is getting involved and carbon dioxide is getting removed, so this is called phosphoenol pyruvate carboxykinase. As simple as that. Okay, now where is this GTP coming from? You remember the Krebs cycle here? You remember here succinyl CoA converts to succinate to form what? ATP. This ATP of the Krebs cycle, in the liver and the kidney, GTP is produced rather than ATP. Okay, and that GTP that is produced in the liver and the kidney, that GTP is involved here. Okay, isn't it interesting how we have linked even the high energy molecules from different cycles? Okay, so please read biochemistry by interlinkage, because as the reactions are occurring in our body, all the reactions are interlinked. It is not like right now my body is um, feeling like undergoing glycolysis, so all my cells will undergo glycolysis, and then after a few hours all the cells will continue towards Krebs cycle. No, everything is happening simultaneously, okay, in real time. So that is how we should read, and that is how we should link. Therefore this interlinkage is extremely important for understanding. I hope you have understood how Krebs cycle, glycolysis, gluconeogenesis and all are interrelated, interlinked. Okay. Now this first reaction we have understood. The second one is relatively easy. Fructose 6-phosphate changing to fructose 1,6-biphosphate in glycolysis through the action of enzyme phosphofructokinase. Whereas in gluconeogenesis, what happens is fructose 1,6-biphosphate will convert to fructose 6-phosphate through the action of the enzyme fructose 1,6-biphosphatase. Okay, biphosphatase. Why ase? Because it will break down the biphosphate. Understood? Now, wherever this enzyme biphosphatase will be present, those tissues can utilize 1,6-biphosphate. Wherever it will not be present, those tissues cannot utilize this. They will have to utilize some other substrates. Okay, now fructose 1,6-biphosphatase is present in the liver, in the kidney and in the skeletal muscle. Okay, so these three tissues can utilize fructose 1,6-biphosphate through the enzyme fructose 1,6-biphosphatase to produce fructose 6-phosphate. And where is it absent? It is absent in the heart and in the smooth muscle. Okay, you just have to remember this. Similarly, for this glucose 6-phosphatase enzyme that will utilize glucose 6-phosphate to produce glucose, what is the normal step occurring, the forward step that is occurring in glycolysis? Glucose is converted to glucose 6-phosphate through the action of enzyme hexokinase, and in the liver, what is the enzyme? Glucokinase. Okay, But there's the enzyme called glucose 6-phosphatase, which converts glucose 6-phosphate into glucose. Okay, and where is this present? We have read about this. Glucose 6-phosphatase is present in the liver, in the kidney. It is absent in muscle, both skeletal and smooth, and in the adipose tissue. Okay, fructose 1,6-biphosphatase was also present in the skeletal muscle, but this one is absent in the skeletal muscle as well. Understood? Now the last step was how glycogen gets converted into glucose 1,phosphate through glycogen phosphorylase, and this glucose 1-phosphate can produce glycogen through glycogen synthase and branching enzyme utilizing UDP molecules, carrier molecules. Okay, understood all these reactions? Now this is a master chart. All of you first look at it, try and understand, and then I'll make you understand through iterating each and every steps. It is a master chart, guys. Please, please, all of you draw this right now. Draw this in your notebooks. Very, very important. You should know how to link different cycles involved in gluconeogenesis together. This is how gluconeogenesis is occurring in the body, interlinking different cycles together. Okay, so we'll just understand this chart and then we'll stop tonight, and tomorrow we'll read about the other aspects of gluconeogenesis and the HMP shunt. Okay, now I'll give you 1 minute to take this down and to understand, and then we'll start with the explanation part. Okay, now take this down. Sorry, take this down. All right. This one is what? This one is glycolysis. All of you would have understood glucose to glucose 6-phosphate to fructose 6-phosphate and fructose 1,6-biphosphate, glyceraldehyde 3-phosphate, 1,3-biphosphoglycerate, 3-phosphoglycerate, 3-phosphoglycerate, 2-phosphoglycerate. Just a 3-phosphoglycerate. Okay. Possible. One is 3-phosphoglycerate. This one is 2-phosphoglycerate. And then it converts to phosphoenol pyruvate. Phosphoenol pyruvate converts to pyruvate. Okay, so this thing, till this part is glycolysis, isn't it? Glucose 6-phosphate, fructose 6-phosphate, fructose 1,6-phosphate, 1,6-biphosphate, glyceraldehyde 3-phosphate, and the other intermediate was DHAP. Remember, but the equilibrium was towards glyceraldehyde 3-phosphate, so maximum DHAP also got converted to glyceraldehyde 3-phosphate. That is what we read yesterday in glycolysis. So in effect, there are two molecules of glyceraldehyde 3-phosphate, isn't it? 1,3-biphosphoglycerate, 3-phosphoglycerate, 2-phosphoglycerate, phosphoenol pyruvate, pyruvate. Okay. Now this pyruvate enters the mitochondria and it gets converted into acetyl-CoA through pyruvate dehydrogenase. The acetyl-CoA enters the Krebs cycle where oxaloacetate is formed, and an intermediate is also succinyl-CoA in the Krebs cycle. Okay. And okay, so this is what normal glycolysis and Krebs cycle is. Now we'll read how we have read about the reactions that are opposite of glycolysis in gluconeogenesis. What are these? When glucose 6-phosphate gets converted to glucose through glucose 6-phosphatase. See, fructose 1,6-biphosphate gets converted to fructose 6-phosphate through fructose 1,6-biphosphatase. Okay. Now, you see, suppose you have a molecule of glycerol. Glycerol is an alcohol that is formed after fatty acid metabolism, fat metabolism. Okay. Now, this glycerol, how will it convert into glucose? Conversion of glycerol to glucose is gluconeogenesis. So glycerol will be acted upon by an enzyme, glycerol kinase, to form glycerol 3-phosphate. Then glycerol 3-phosphate dehydrogenase, G3PD, glycerol 3-phosphate dehydrogenase will convert it into DHAP. Isn't it familiar? Where is DHAP involved? Glycolysis, guys. Now DHAP will enter glycolysis. This is a reversible step. It will form fructose 1,6-biphosphate very easily because it is reversible. Now fructose 1,6-biphosphatase will act on it to produce fructose 6-phosphate. It is reversible. It will form glucose 6-phosphate. Now glucose 6-phosphatase will act on it to produce glucose. Okay. This step cannot occur in the muscle and in the adipose tissue because they lack glucose 6-phosphatase. This step cannot occur in the smooth muscle and the heart because they lack fructose 1,6-biphosphatase. Clear how we have linked whatever we have understood? So this is how glycerol forms glucose. Now another molecule that we read was lactate. How does lactate form glucose? Lactate will be converted into pyruvate. Then pyruvate will have to go backwards to produce glucose. How does it happen? We have read the first step, pyruvate converting into phosphoenol pyruvate. Remember the first step of gluconeogenesis, the first reaction that we read tonight? Lactate will convert into pyruvate. Pyruvate will convert into oxaloacetate through pyruvate carboxylase. Pyruvate carboxylase. This oxaloacetate will become phosphoenol pyruvate through phosphoenol pyruvate carboxykinase. This is reversible, so it will become 2PG. This is also reversible, become 3PG. This is also reversible, it will become 1,3-VPG. This is also reversible, it will become glyceraldehyde 3-phosphate. This is also reversible, it will become fructose 1,6-biphosphate. Now again the same step, fructose 1,6-biphosphatase will convert it into fructose 6-phosphate. This is reversible, it will become glucose 6-phosphate. Glucose 6-phosphatase will convert it into glucose. So this is how lactate has become glucose. Understood, everyone? Two steps of two forms of gluconeogenesis we read. Glycerol converting into glucose, lactate converting into glucose. Now we'll read how propional-CoA or propionate converts into glucose. How does it convert? First of all, where is this propionate coming from? It is coming from beta oxidation of fatty acids containing odd number of carbon atoms. That means, suppose there is a fatty acid containing 20 carbon atoms. So on beta oxidation, complete beta oxidation, it will produce 20 divided by 2 is equal to 10 molecules of acetyl-CoA. So one fatty acid chain will produce, on complete beta oxidation, produces acetyl-CoA. Okay. Since acetyl-CoA is a 2-carbon compound, therefore the number of carbons contained in the fatty acid will be divided by 2 to produce that many molecules of acetyl-CoA. But suppose it is an odd number of carbon containing fatty acid, then one propanyl-CoA molecule containing 3 carbon atoms will be first produced to convert it into an even carbon chain. Okay. Now this is what? A propanyl-CoA molecule. And 18 divided by 2 will be 9 acetyl-CoA molecules will be formed. Got it? So this propanyl-CoA molecule will then enter gluconeogenesis. Understood? This propanyl-CoA converts into succinyl-CoA, which is present in the Krebs cycle. Succinyl-CoA will form oxaloacetate. Oxaloacetate converts into phosphoenol pyruvate. Through phosphoenol pyruvate carboxykinase. Again, it will undergo the same process. Understood or not? Understood, all of you? So this is how propanyl-CoA converts into glucose. Now, how does acetyl-CoA convert into glucose? Acetyl-CoA, how do fatty acids convert into glucose? Fatty acids will undergo beta oxidation to produce acetyl-CoA. This acetyl-CoA will enter the Krebs cycle. It will produce oxaloacetate. Oxaloacetate will produce phosphoenol pyruvate, and again it will produce glucose. Understood or not? Always remember the 3 enzymes involved with pyruvate, that are pyruvate kinase, pyruvate carboxylase, and pyruvate dehydrogenase. Pyruvate kinase produces pyruvate from phosphoenol pyruvate. Pyruvate carboxylase produces oxaloacetate from pyruvate. And pyruvate dehydrogenase produces acetyl-CoA from pyruvate. Understood? All of you, these are the main reactions occurring in gluconeogenesis. I have tried to simplify them for you. I hope you guys have understood what gluconeogenesis is, what it means essentially, and how it occurs. You can take a moment to understand this process. You can write this down. Okay, and then tomorrow we'll continue with different important applications, 2,3 by fructose 2,6 biphosphatase and all these enzymes, all these important molecules that we have to read. We'll in the application part we'll read tomorrow. Okay, now I hope you guys have understood. Okay, now I'll take your leave now, and we'll meet tomorrow again. Do subscribe to this channel if you haven't for more such interactive videos and videos involving ease of learning. Okay, alright then, see you guys. Bye bye. Thank you. Good night.